Hi, it's Sandy Wiley. Welcome to my mental health channel, where I wipe away the stigma of mental illness by talking about my own personal struggles having borderline personality disorder, post-traumatic stress disorder, anxiety and depression. I talk about narcissism and schizophrenia, and I wrote a book, Life with My Schizophrenic Father. I talk about my unethical psychologist with I've had sexual relationships with, and the links to all these books are down below in the description. They're all available on Amazon for your purchase. You can also help support my channel by buying me a coffee. I got the link to that below too in the description. But I only come on here as a former patient of almost 20 years. I am not a licensed therapist. I do not hold a degree in psychology, so I cannot diagnose you. And all I ask in turn of you is your kindness and respect in the comments. Now, if you are new to my channel, welcome. Please hit that subscribe button down on the lower right-hand corner. That way you will be alerted every time a new video of mine comes out. It's 100% free, so stick around, take a chance. Please let me know your thoughts and your opinions. I always get back to everyone that comments. And please feel free to share my videos with your friends, your family, and on your social media platforms. Today, I'm going to talk about why borderline personality disorder patients do not get along with therapists. A lot of personality disorders, not just borderline, like narcissistic personality disorder, they don't do well in therapy either. Most of all, they con the therapist. This is what I've read. But I'm not going to talk about narcissists today because I'm not a narcissist. I have borderline personality disorder. And I can vouch that psychologists do not get along at all, really don't help, and are detrimental for people with borderline personality disorder. They're downright frightened of us because, the social media and movies and TV shows and books have portrayed us like psychotic, vengeful criminals who, hurt themselves and hurt other people, are enraged and go after people and harm people. Let's just say we get a very bad rep from the movies and from everything else out there. Psychologists do not want to take on borderlines. I've experienced this over and over again. I had a female therapist who said she'd be happy to see me. She had plenty of openings. She said plenty of openings. She'd be happy to take me on as a patient. And I went in for a session and I talked to her. I did not say I had borderline personality disorder. I didn't tell her anything. That about my diagnoses in the past. I just talked about my problems. I was having a 2-year sexual affair with my current psychologist. I talked about how I lost friends because a lot of things, I just went into about, what was going on in my life at that time. That I had a brain damaged son who was in the hospital and yada, 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 yada. So after the session ended, I said, well, I'll make my next session now because you've taken me on as a patient. And she said, okay. And then she made a session, gave me a card for next week, same time, same place. So let's see, was it the next day? My cell phone rings. It's this woman therapist. And she goes, I'm going to have to cancel our therapy appointment for next week. And I said, oh, okay, that's fine. I'm very flexible in my schedule. And she said, you know what? I don't think this is going to work. I said, what? You just said that you had plenty of openings. I had a very good, what I thought was a very good rapport with her during that one therapy session. You just made an appointment with me. I said, well, why not? And she said, oh, I just don't think it's going to work. I really don't think it's going to work. Don't feel bad. We just don't take your type of people. What? Did she just say that to me? We don't handle people like you here. That's what she said. We don't handle patients like you here. You have too much on your plate. Those are her exact words. And this was a woman, okay? Now, this isn't the only therapist. I've been to, oh my God, dozens and dozens of therapists in 20 years. And none of them ever wanted to take on someone who had borderline personality disorder. I did not tell her I had that. Somehow, because of her training, she must have picked up that I was a borderline from talking with me for 50 minutes. She must have picked that up. I don't know what I said, but she must have assumed that. And this is, when I first met Dr. Barberia, the one that I had a 2-year sexual affair with, he did not want me for a patient because I had borderline personality disorder. He goes, we don't, patients who have your borderline personality disorder, they only see doctors in hospitals. In hospitals. I never been hospitalized at all for my personality disorder. But this is what he said, Dr. James Barberia. Then he goes on to fuck me. Like, does that make any sense? For 2 years, mind you. 2 years. He tells me when he first meets me that, people with your disorder only see doctors in hospitals that, and he had a home practice, because he told me that he used to see a borderline patient in a hospital setting where he had a button, like the button under the desk, in all those films and everything where they press and then the SWAT team comes. Look out! Hands up! Well, he told me he had a borderline patient that pulled a knife on him. This is the one I had sex with. And I guess he had post-traumatic stress disorder from that. She got angry and she switched a knife in the session. So he did not want to deal with another one, but then he ends up having sex with me for 2 years. Isn't that a little strange? Don't you think that's a little bit odd? Anyway, all the therapists I had, didn't want anything to do with me because of my borderline personality disorder. I'm going to tell you, it's probably true. The closer I get to someone, and therapy is a very close and intimate relationship. You're in a room, walled off from, life, from society. You're in this room with this nice long couch. No distractions, the door is locked, A lot of these therapists had home offices, so no one else was around. So they couldn't yell for help or anything. They didn't have a button under the desk to push for the SWAT team to come up. So that is why they're very afraid, because I do have borderline personality disorder. I have a very volatile personality. I'm very intense. I have an extreme fear of abandonment, and so it's very hard for me to open up and get close to someone. So when I open up to the therapist and become very, very close to someone, my abandonment issues all surface, and I get very, very frightened and scared. And I also get post-traumatic stress disorder. I get very easily triggered because I'm so scared, because my dad left me when I was a little girl. He was in and out of mental hospitals, and he left. He had a nervous breakdown, and he was hospitalized. And I'm just so scared every time, I get close to someone and intimate with someone, that they're going to abandon me. And therapy is a situation prime for that to happen, because you get very intimate with your therapist. You're opening up everything about yourself to this stranger, you know, who you're totally alone with. No one else is around. It's very intimate. And that takes a lot of courage in of itself. It takes a lot of courage to be able to do that. And I just get very frightened and scared. And it's like I'm giving them my heart. When I open up to the therapists in these therapies, I'm giving them my heart and putting my heart literally in their hands for safekeeping. And what's the saddest thing about this is that none of these therapists protected my heart. What they did is they took my heart, the ones that accepted me as a patient. Not all of them accepted me. I gave you an example of that woman who said, we don't take your kind here. You have too much on your plates. They take my heart and then they stomp on it and smash it to bits. And that's why I stopped going to therapy altogether. I've been burnt. I've written all these books. I have a LinkedIn newsletter. You can look me up if you're on LinkedIn, Sandra Wiley. And you can, you know, subscribe to my newsletter for free and read about. I've written all these articles, these news articles about what I've been through. You can look at all my videos in the past that I've talked about these therapists. They just mistreated me terribly, 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 terribly. The ones that took me on, they took advantage of me. And I just had a horrific time. And that's why I came out to say in this video that borderlines do not mix with therapists. You know, we just don't. It's very hard for us, and it's hard for the therapists too to relax and be able to handle us. The ones that do take us on, we're too intense. This is what Dr. Richard Geist said to me in this book, Love Bombs by a Harvard psychologist. He took me on, by the way. It lasted 2 years, and then he said, "You're too intense. You're too demanding. You want too much attention." And he pulled back. And that is the worst thing you can do for a borderline. Pull back on them and just, he re-traumatized me all over again. By ignoring me, ignoring my pleas for help. I was so, desperate for help. He wouldn't see me. And, you'll just have to read the books about what happened in that therapy. But I went to his office drunk, and he let me drive home drunk. I got drunk, stone drunk, because I wanted to show him how much pain I was in, and what I was doing to myself. I was killing myself with vodka every single day. And I showed up. I told him I had 3 vodka drinks before I got there. But the funny thing is about vodka is that I didn't feel the effects of the vodka until I got to his office, I was drinking like in the car and drinking on the way down. This is true, like even at a bar. You can be drinking a couple of drinks, 2 or 3 drinks at a bar. But then when you stand up, to leave, after you pay the tip and everything, you can say, "Oh my God, these drinks have really gotten to me." You don't know when you're sitting down and you're drinking them. And this is what happened. And I told him, I'm drunk. I can't, I don't know how I'm going to get home. He says, "Well, drive safe." And he knew I was driving. Those are his words to me. "Well, drive safe." I had to call my husband and ask for I was so drunk, I had to ask my husband for play-by-play steps on how to get home from his house. I didn't know my way home. I was that drunk. So, yeah. My days of therapy are over. It's been 3.5 years now, therapy free. I will never go back to another therapist again. As I stated in the beginning of this video, borderlines do not mix with therapists. I firmly believe it. If you're a borderline and you've had a positive experience, in therapy, please let me know, because I haven't met one. And I've been to women, I've been to men, I've been to young, I've been to old, I've been to all different kinds of therapists, and not one of them could help me. And most of them were frightened to death of me. One was wringing out his hands in the therapy session like this. His name was Brad. He was ringing. I can't see you anymore. You got to go now. I said, well, it's not the end of my session. I've been seeing him for a couple of months, too. And he's wringing his hands like this. It's really not good for me to see you. He was like having a full-blown panic attack right there in the office with me. And I said to him, but I don't understand. You agreed to take me on. And then he got up and he said, please leave. Just like that. I didn't do anything to him. Just like that. After 2 months. Just like that. Please leave. He did tell me that he did have someone else take him to the board. And he was frightened because I have borderline personality disorder, that if I got angry with him, that I would retaliate and take him to the board. And he said I could never go through that again. He didn't say if the patient that took him to the board had a borderline personality disorder, but he knew I had it, and he was scared that I would get upset. And if borderlines get upset, forget it. You're dead meat. That's it. Yeah, they take no prisoners. So that's just a small sample of, why I don't think that we mix, and I will never put myself in that situation again with another therapist. I don't care how highly recommended they are or what they are, a woman, man, young, old, or whatever they are. I am done. 3.5 years clean of therapy, and that's the way I'm going to stay. Let me know your thoughts and opinions in the comments, and until next time, take care. Bye-bye.